Things that also were really confusing is that every payer has different ways that they want you to communicate with them. Some are faxing, some are making phone calls, some you have to go on websites and submit documentation and then follow up. So that's also very confusing. And how does, how people do that. Delays in care. Sometimes you have to submit these authorizations, 10 days in advance, 2 weeks in advance. And a lot of times our surgeons, want to move forward or want to, have care. During COVID, we had a lot of shortages. So we had people that didn't want to work inside the offices. So then we had to start looking for outsource vendors or people that were willing to take on this space and people that you could collaborate with and then create new workflows on how do you pull them into, your process. And then I think, looking at it sometimes from the patient's point of view, we always look at it from our point of view, but that patient, delayed access to care, sometimes a financial hardship, the doctor's telling them they need a procedure or they need something done, but their insurance company's not paying for it. So now you have to start having conversations with them about the cost that it's going to be for them. And then the frustration and confusion that happens on both sides, so what's approved, what isn't approved, how do we let the patients know? And then authorizations are really getting a lot into the pharmacy space now too, with all these high-end, medications and weight loss medications and things like that. And even in just some diabetic medications. So then you start to have patients that are lacto adherence on some of their medications because they can't afford it or their insurance companies aren't approving it. So then they just choose not to take the medication.